Buenos días, colegas.
Good morning, everybody, dear colleagues. I'm Rosa Sandoval. I'm regional director at PAHO for this subject. And, well, we want to share the strategy and action plan for 2025-2030. And we are organizing it together, PAHO with ASH and corporate accountability and other institutions mentioned here. And I want to share the goals for today to socialize, to spread the agenda and the plan, the program for next year's that was approved in October last year. In second place, to exchange experiences about how regional and global organizations can foster the adoption of these guidelines in countries that have tobacco control and others that don't. And also, we want to hear about experiences and successes based on these experiences and share the actions of the civil society that support our goals and how our action plan and strategy can strengthen these efforts. Well, I would like to share now some logistic information so that you can profit from today's event in the best way possible. So, thank you very much. Thank you for the slides. First of all, I want to share with you that this session is being recorded. We do have simultaneous interpretation in English, Spanish, and Portuguese. And if you have any difficulties to find the icon or it doesn't work properly, we recommend updating the Zoom version in your device. You can find that on the lower part of your screen. So all participants must register through the Zoom link, and if you are today with us, you have already registered, and if you have gotten the link from another user, please register on the corresponding format. And on the menu, you can send, you find the possibility to send your questions in writing, or you can raise your hand, and at the end we will share a short questionnaire about the success or the problems with this Zoom. We have an agenda for 1 hour and a half, and we would like to go to the beginning of the webinar. We will hear the welcoming works from Vanessa Garcia Larsen, who is head of unit at PAHO, and from Laurent Huber, who is the executive director of ASH. Vanessa, please go ahead. Thank you, Rosa.
Good morning, colleagues, partners, and friends.
Good morning, everybody.
Welcome you all to this webinar. Today,
Quisiera
we will the strategy and plan of action to strengthen tobacco control in the region of the Americas 2025-2030. This is a key milestone that reflects the strong political will and commitment of our member states to advance tobacco control and protect the health of all people in the region. Last year, several of you supported the approval of this strategy during the Pan American Health Organization's Directing Council, and your continued engagement is critical to making this agenda a reality. As we move forward, we build on the significant progress achieved in recent years to address the tobacco epidemic in the region of the Americas. The feasibility of adopting evidence-based policies that are aligned with the WHO Framework Convention on Tobacco Control has been clearly demonstrated. However, we also need to acknowledge the growing challenge posed by emerging nicotine and tobacco products which are often deceptively marketed by the tobacco industry as healthier alternatives to conventional cigarettes, particularly targeting young populations. This strategy provides member states with a clear roadmap to strengthen implementation, tackle new threats, and protect vulnerable populations. As mentioned by my colleague Rosa, today's event is jointly organized with 3 non-state actors in official relations with PAHO that have made major contributions to advancing tobacco control in the Americas: Action on Smoking and Health, Corporate Accountability, and the Global Alliance for Tobacco Control. This partnership embodies what we often call our magic formula for progress, working together across sectors and organizations. Sustained cooperation with government, civil society, academia, and international partners will enable us to maintain momentum and achieve real impact. Let me thank you all once more for your dedication to advancing tobacco control in the Americas. I'm confident that today's dialogue will inspire renewed collaboration and shared action. Thank you.
Muchas gracias, Vanessa. Efectivamente, mantener el momentum y continuar alcanzando las metas que ya hemos
Thank you,
alcanzado.
Vanessa. And we do have to continue trying to reach our goals. I would now like to pass the floor to Lorenzo. Thank you, Lorenzo. Thank you, Dr. Rosa. As non-state actors, we're very much satisfied with the adoption of the strategy and plan of action to control tobacco in the Americas 2025-2030. And even the actions previous to the adoption of this plan have already been beneficial. And to coordinate the strategies of this plan for conventional and emerging tobacco products, and also the services for tobacco control, and the protocol for illegal trade of tobacco products, and the strengthening of the capacities for fighting against the tobacco industry. There are more than 8 million lives that are lost in the world because of tobacco, and in regions of the Americas, the figure is about 1 million. And so we want to enlighten our citizens about the dangers, continue enlightening our citizens about the dangers of tobacco industries, tobacco products, but the industry has its own strategies, and these continue to be an obstacle. And we see this. Well, there will be a meeting in November this year, and about this issue, because, well, these meetings want to delegitimize the results we have achieved. The tobacco industry is fighting back. So this is not only a plan and a strategy that was set up by the actors present today. And we hope that the civil society present today will continue working with PAHO and the governments of the Americas to accelerate the progress toward eliminating tobacco products in the Americas. And well, we want to implement the protocol of PAHO against tobacco in its totality, and we also want especially to stress the fact that we want to protect human health, applying measures that go even beyond the convention that was signed. Thank you very much. Thank you, Lorenzo, for your words. And we just want to stress what Vanessa told us about this magical formula that has worked very well in the region of the Americas, And we want to thank you for your cooperation, for the cooperation of all non-state actors, because this is the magical formula, a cooperation among different institutions to eradicate tobacco products from our region. So we have almost 300 participants that are accompanying us today, and we would now like to give the floor to Luciana Severini, technical official at PAHO, and the WHO, and who will tell us about the strategy 2025-2030. Well, thank you very much, Rosa, for the introduction. Good morning, everybody. I hope that you can hear me well. And as Rosa said, I am a technical officer for tobacco control in the region of the Americas, and I will tell you about the content and the approval process by member states to strengthen the control of tobacco in the Americas between 2025 and 2030. So what I will tell you about the presentation of the plan, the first part will be an introduction about the development and approval by the members of PAHO, and then we want to go into detail about the contents of the strategy and the plan of action. The the action plan and the strategy have several strategic lines, and then some that we will describe, and then there will be some reflections about the future, some thoughts about the future, and what we expect from the strategy and plan of action. So starting with a timeline, we prepared this presentation, I thought about the long time we have spent on this strategy, and I want to share with all those present today that, well, you probably knew about the previous strategy from 2018 to 2022. In 2023, during the Executive Council 2023, we approved the final report of that strategy that ended in 2022. So in 2023, we approved a final report that showed us progress made. And in this context, we also asked the member states, the member states asked for support, were asked for support for developing a new strategy, taking into account the difficulties that we found to reach the goals of the previous strategy, and also to continue making progress towards these goals that were not reached. And well, the strategy was also deployed during the COVID period, and there were some difficulties because, of course, the control of this pandemic took priority. And of course, also because we were looking in 2023 at many challenges, emerging challenges, for example, the emerging nicotine products, the electronic cigarettes, and other possibilities to use nicotine. So we thought we needed to continue our efforts and also face new challenges. Apart from this development, the development of this new strategy, well, this strategy went through consultations with national governments and with bilateral meetings with the government of the United States, and there are two instances that where discussed this strategy. The first one was during the executive committee meetings of PAHO, and also in the directive council in October last year. We discussed this strategy and we approved and all member states and national authorities approved this strategy that, as well as the previous strategy will go through an assessment, a midterm assessment, and then at the end, when the strategy finishes its period, we will also examine the results. And so during the discussion, here you see the picture of these discussions. We approved in October, on October 3, the day before the last of the period of this session, and the resolution adopted was a resolution that showed more interventions in favor from all official representatives at FAO. And today, this webinar is organized together with organizations that also added their statements in favor of the strategy, and this shows the historic cooperation that exists regarding this issue. And so this is to tell you about the process of the approval by the member states. And now I will tell you about the contents and the goals of this strategy. The document in itself proposes a roadmap up to 2030 to apply the measures that are within the framework covenant. And we also, as I mentioned before, and before starting my presentation, I saw in the questions, the chat, that, there was a question about the emerging nicotine products, and they were also incorporated in this roadmap up to the year 2030. And of course, it agrees with the goals of the strategy of the Association to Control Tobacco Products. And so the protocol includes all the suggestions of how to face these problems. And it also agrees with the objectives, the goals developed for 2030. And on this slide, you can see the World Plan for Non-Transmittable Diseases and the one for the control of tobacco, and all of them were extended until 2030. And so, as I was telling you at the beginning about the contents of this strategy, the strategy is completely aligned with the other mandates at world and regional level. And it also coincides, it also mirrors the time frame. So the strategic lines in itself will now be described. This is a general presentation. We have 5 strategic lines, and I hope that I will remain within my time frame. So before going to the strategic principles, there are some differences with the previous one, so that you can, and here there is an overlook. It includes an indicator about electronic cigarettes. It includes a strategic line on the treatment of dependence. See? And then we have the strengthening of the strategic line of taxes imposed on tobacco, and the strengthening of the strategic line about the interferences of the tobacco industry. I invite you to read the whole document, because the strategy is very well explained in the document. It includes an introduction and also the positions of the member states, and there are specific mentions about questions that are really on the table presently. such as the difficulty about digital means and how the pandemic became an obstacle for non-transmissible diseases. And then we have the whole industry, tobacco industry, and their strategy for promoting nicotine products. And there's also the responsibility of the tobacco industry in the framework agreement, and the mention of the link between the framework agreement and the protection of human rights. And precisely many of these issues were mentioned in the COP, in the convention, in the meeting of the parties, and they are also mentioned in this strategy. And regarding strategic line number 1, is about the implementation of effective measures to regulate consumption, the trading and publicity of tobacco products, conventional and others. And so what are the lines included in this strategy? There are 3 measures. Tobacco-free or smoke-free environments. All closed environments must be free of tobacco smoke. And well, the warnings about on the packages of tobacco product, and there are some common strategies here. We're talking about measures that need an intervention of state regulation, because they cannot be voluntary. That is, measures that can be adopted voluntarily by the states. They have to be established as such by a legal procedures to turn them into mandatory. And then there are 3 measures. When you read about the framework conventions, there are specific timelines established. And so the state parties that have not adopted these measures are out of the timeline. And these are measures that when you find how the states include these mandates in their national legislations, these 3 measures are included in only one regulatory tool. And that depends on the countries. It also has to do with how fast these legal measures are implemented. And of course, but they should be part of all legal structures in each country. And I will not stop on all goals and strategies, but I wanted to tell you about some details so that you understand also when we talk about this, when you read the strategy, we see that goal number 1 is linked with legislation for tobacco-free environment. And of course, there is also the question about the warnings and on tobacco products, on the packaging. And those of us who are working on these issues, have been working on these issues for a long time, we see that there are many countries that have supported the tobacco-free environment, but are not so keen to control the advertising on the packaging. And the baseline, as you can see, is from the year 2022. This was the latest information that we had at that time by WHO, and it has been validated by the member states, and it's also the final cut line of the previous strategy. There is a specific goal about electronic cigarettes. And here we want to, it is stated that the midline and end reports, they should tell us if if these products have been regulated or forbidden completely. It's because the electronic cigarettes and how to regulate them can be prohibited completely, or they can be regulated applying the same guidelines as for tobacco products, conventional ones. So if you cannot smoke a cigarette in a closed environment, you shouldn't be able to use the other tobacco products in the same space, kind of space. And there's also the total prohibition of publicity, not only for tobacco products, but also for other, not only for cigarettes, but also for other tobacco products. And in the midterm report and the end of term report, there are data about how the countries are controlling nicotine products, and many countries or many authorities are telling us that there is also an increase of the use of tobacco products by the young population. And there are also strategies related with pricing of tobacco products and taxes. And if we talk about taxes, this is a triple win strategy, because the products are less bought and there's a control of demand, and there's also the benefit of additional income for the states, and in the long term they might control the consumption of tobacco products and increase the productivity of workers. And here you can see, and I don't want to stop here to focus completely on this. There is a second, because of the time, there is a second section about the number of points. There is a scale of points that was for measuring progress that was not present in the previous strategy. It has 4 components in order to be able to assess the progress in each state. I have here these 4 components: the price of cigarettes, the participation of tax in the price, and the structure of the taxes. And this is, of course, supported by WHO and by PAHO, and it's also mentioned in the report. And we will also share through this chat, and after this meeting, we could share with you, we can tell you about all the reports and information, and we will facilitate this data, because there are many issues and I don't have enough time to stop on them in detail. And then we have strategic line number 3 about comprehensive services on quality, about tobacco dependence. And this strategic line is also mentioned here. And there's also the offer by WHO for promoting this cessation. And there are many questions and issues mentioned here about not consuming these products in a closed space, and also about the warnings that have to be added to the products for the public. And these measures are very useful for reducing demand, but anybody who has the addiction also needs help to abandon consumption of these products, because these are addictive products. So we have to provide quality services for abandoning the consumption of tobacco products. And all this is part of an essential component when we try to have a comprehensive look at tobacco products. All these measures help people to not fall back to consumption, to not be doctrine side of this. And PAHO has also established among the best investments for the prevention of non-transmittable diseases. It has included the comprehensive services for ending the consumption of tobacco products. And so these are the measures added to the measures I mentioned before.
Let's talk about strategic line number 4, because I'm almost at the end of my time. And please let me know if I'm running late. But strategic line number 4 has to do with the ratification of the WHO framework agreement and the protocol for the elimination of tobacco products. The framework convention or the framework agreement is the reference, the legal reference. It's the first agreement sponsored by the WHO. It was adopted in 2003. It entered into force into 2005. It is an agreement that systematizes scientific evidence to tackle this issue. We could say a lot of things about these international treaties, but 3 very important characteristics are that it contains measure based on scientific evidence. It is a treaty that has measures contrary to the tobacco industry, all aligned with public health. Well, on the other side, we have the intentions of the industry, which is selling a product that kills and creates illnesses. And it also has an important agreement on the interference of the tobacco industry when it comes to adopting tobacco policies, because there is this inherent conflict of interest. And another issue is that it has a connection with the international human rights system. The framework agreement has measures for reducing demand and also supply. Article 15 refers to the illicit trade of tobacco products, and there is also a protocol that is a treaty, an international treaty in itself. And today, in the Americas region, we have 30 member states that are part of the framework agreement. And for those who have ratified the protocol, it's 7 countries. Due to the legal relationship between both, a state can only be part of the protocol if it's part of the framework agreement. And the idea is, of course, to show the progress in this sense. They're letting me know that I'm talking too fast, so I will try to move to go slower for the interpreters. Another important information that I wanted to mention is that although the ratification of the Framework Convention and the Protocol are 2 key aspects to regarding the international legal mandates and also to participate in party conferences and the decision-making table. There is also Argentina, for example, that is not a member state, a party state, but it has adopted measures in line with the PAHO Empower package, and it has adopted measures for the control and prevention of non-transmittable diseases. I also wanted to say that we hope to finish in 2030 with the best possible amount of possibilities of getting closer to the target, but the framework protocol reunites how to tackle these problems and also what are the measures that have to be adopted, and this international consensus. And well, there are countries that are not part of the agreement, but that have adopted measures in line with those legal agreements. And then we have strategic line 5, strengthen the member states' capacities in terms of public health to face the attempts of interfering from the tobacco industry and those who defend their interests. there is a huge opposition between the measures that we just mentioned and the industry that seeks to promote a product that creates illness and that kills. And so the Framework Convention also has the strategic action line. And so the idea is to take measures to try to interfere the intentions of the tobacco industry and those who defend its interests. This indicator is in the former strategy, and it's the only indicator that reached its target. This indicator, in the former strategy, there was a specific mandate so that the PAHO Secretariat would develop a methodology to be able to assess what member states had a mechanism to identify and manage the conflict of interest for officials. And this methodology was created with experts in this topic because it was the only indicator, it was the only methodology that didn't exist at that point regarding the assessment and the information report that WHO has since 2018. And so this indicator shows some progress. And one of the questions that appeared from national authorities is that, okay, this indicator showed some progress, and we should include a second indicator that has to do with what member states have an observatory that monitors the industry's activity to try to interfere in policy development during the strategy and action plan period. And so we hope to reflect this in reports at the end of term. So I got to the 5 strategic lines. I'm sorry for the speed. It's a lot of information. I wanted to at least share picture with you. And we also invite you to share this evidence and to finish the organization. And this is something that we always discuss. We always try to work jointly with research based on scientific evidence, civil society, because civil society can also mobilize public opinion and demand accountability. And it's also important to have an important leadership from the health authorities. And then the routes to reach your objectives are diverse. It depends on the states. For example, if we start with a subnational level and subnational measure, and then we go to national level, maybe we start with a regulatory initiative by the executive power, or maybe a law and the legislative power. Well, that depends on the context, on the structure of each country. And 2 instances in which we will have a progress is the midterm report and the end of term report in 2031, when this strategy will end. Some learnings. The learnings are described in the former report strategy, but I do believe that it is important to put them on the table. These measures, the ones that we mentioned before, have proved to be economically and legally viable. There is multidisciplinary evidence that supports them, as well as courts around the world. And so the framework agreement went into force 20 years ago, and there are resolutions from the organization. What I want to say as a final reflection is that there's a lot of evidence, and there are a lot of best practices and evidence that support the legal, economic, and political viability of these measures. It's also important to have leadership from the health authorities in coordination with other sectors, not only health, economy, trade, and collaboration with civil society and the academia. This was very decisive to be able to move forward during these years. And we also believe that it is decisive looking at the future, and also the member states approved something in the final report is that the learnings regarding tobacco control have been around for many years, and there is so much experience regarding how this was adopted and what it affected to combat one of the main preventable death cause in the world. And we hope that this resolution and that strategy can move forward with proved and cost-effective strategies to face nicotine addiction with these new products to protect health and especially people that are in a vulnerable situation. That's all. And now I give the floor to my colleague from the organization that will be introducing the panel. We hope to be in contact. Please do let us know for any if you have any questions. Sorry for the speed, sorry to the interpreters, and I hope that I was able to share the main components of the strategy. Thank you very much. Thank you very much, Luciana, for this excellent presentation. I believe that, as you said, it is screenshot of the strategy. The strategy is pretty big as well, but we have been sharing through the chat several links with useful resources, including the link towards the strategy. And we're also about to publish a friendlier format that we will also be sharing afterwards with the Stripe people so that they can have some more time to review this. And now I would like to floor space for our second stage. We will have Lorenzo Habet, executive director. Thank you, Lorenzo, for turning on your camera. And we're also going to invite the panelists that we have for this morning. We are running a little bit late with the agenda, and so I believe that we will be able to have one question for each panelist, given that we will not be able to take into account all of the questions. In the first place, I would like to invite our first panelist, Oscar Flores Collar, from the Tobacco Control Office. Oscar, would you be so kind to turn on your camera? Good morning. We have a first question. The non-transmittable disease context. How can Mexico's experience in terms of tobacco control could be used to contribute to create an approach for non-transmittable diseases? Thank you very much, Diana, and thank you very much to the organizers. Thank you for the invitation to this wonderful event. From our health subsecretary, Dr. Ramirez Elizalde. Hello to everyone. And in Mexico, we understand that in the Americas, epidemiological data is very clear. 80% of deaths are caused by non-transmittable diseases, and tobacco is one of the main risk factors, preventable risk factors that contributes to this disease and death load. In Mexico, we understand that non-transmittable diseases cannot be only tackled from clinical spaces or spaces that try to improve individual lifestyle. They are necessary, but they are not sufficient. This must come from comprehensive strategies that reduce exposure to nicotine. In our country, we believe in the application of the Empower package, and this is something that we have tried to do in spaces that are 100% free of 100% tobacco smoke free. We have a very clear regulatory framework, and the population has received very well the intention of applying this. And of course, other measures like total prohibition of advertising, the strengthening of sanitary announces, and we have reinforcements or strengthening in this sense. Also, measures to help people stop smoking. We have a line 24 that's available 24/7 and every day of the year. And these measures also try to reduce consumption. We believe that this is a way of dealing with non-transmittable diseases. And we also believe that the most important thing is regulation. We don't not only have regulation, we have this is a clear governance mechanism, and we believe that that's very important in our country for collaboration, participation, and especially for to convince the population, not only for decision makers, but for the population in general. And Mexico has moved and understands that tobacco is a very important factor of non-transmittable diseases. And one of the ways of facing this is having more control over tobacco in all of its presentations. We also understand that from this perspective, regulation in these control scenarios can be a base policy to face non-transmittable diseases. Now, every time that we have an impact is breaking this this works with younger populations, and this is also our commitment. In Mexico, we are fully committed with strengthening tobacco measures because this helps reducing the risk and this non-transmittable disease load. Thank you very much, Oscar. We know about the context and Mexico's experience. We know about the progress we have made in terms of tobacco control. Could you please tell us how do you think that the strategy contributes with facing these challenges they have in the country, especially regarding regulation of emerging products and illicit trade? Yes, thank you very much. In that sense, we are also convinced that the regional strategy upon which we have worked for 2025, 2030, and especially Article number 3 allows us to have instruments to protect national laws and regulations against the intervention of the tobacco industry. This is not only through conventional tobacco. They try to distribute new tobacco through new ways, or nicotine through new ways, like vaping machines for young people, to evade regulatory frameworks. And this is to target younger people. And Mexico issued a presidential decree and also a constitutional reform based on the precautionary principle, where it prohibits all activities related with electronic cigarettes, vapors, and any other similar devices, which is essential to face these commercial interests. This is how we protect the population. This is how we avoid normalizing the exposure to these products, because among young people, and among people who use these products, well, they say they're very practical. And so this is why we issue these maximum protection mechanisms. And this is fully articulated with Article 5.3 that mandates that states have to protect public health in the face of commercial and private interests. So we have to strengthen these actions. Regarding illicit trade or illegal trade, which is something very important for our country, evidence shows that making the regulation more flexible is not necessarily very efficient. It is also important to strengthen the state, strengthen regulations, and strengthen international coordination. And Mexico is very interested in reducing illegal tobacco trade. The industry promotes harmful projects, and it designates more money to this than governments to prevention. And so without international cooperation, the efforts could be annulled instead of having real transformations. We, and we want to send this message to the region, are convinced that without political collaboration, we could not be able to apply Article 5.3. If we don't control tobacco, we cannot reduce the load of non-transmittable diseases, which has a huge cost in terms of lives, but also in terms of budget. And so we have to face this challenge not only as a country, but as a region, and also build an international common front, like a regulatory mechanism that is solid, complex, and that also receives international support funds, not only for the country, but for the whole region. Thank you very much, Oscar. Great contributions from Mexico's experience. And now I give the floor to Lorenzo, my co-moderator. It has been very interesting to listen to Mexico's contribution on the leading country's challenges. Mexico is a country that's moving forward on this agenda, and now I'm going to present the next speaker. Lorenzo Vázquez from the Prevention and Control Tobacco Office in Cuba. And the first question is, as a country that is not part of the framework agreement, how can you use a regional strategy to orient your tobacco control efforts? Lorenzo, sorry, it looks like we are having difficulties. I believe that we have lost our colleague Lorenza. Elba, sorry. Elba, are you connected?
Ahí la escuchamos. Adelante, Elba.
Please go ahead, Elba. We can hear you, but we cannot see your video. Can you see me?
No, pero adelante, podemos escucharte. Sí.
Please go ahead.
Ahí está. Vemos el fondo de pantalla, pero no logramos verte a ti.
Bueno, son dificultades técnicas. Ante todo, buenos días a todos y todos.
So, first of all, good day to you all. It's an honor to be here to talk about us in our country. The strategy and the action plan. I'm sorry, but the sound that we are getting is not very good.
Y por ello estamos llamados a redoblar los esfuerzos en función de estas medidas de probada efectividad que pueden reducir
measures that can reduce tobacco consumption in our country, and so morbidity and death due to this cause in our country.
Una alta movilidad, una alta mortalidad, como se dijo anteriormente, en la región, 1 millón de personas pueden morir anualmente.
A million people can die annually from this cause, but in Cuba, 13,000 people die from this cause. And so it is an important consequence for health. This strategy prioritizes internationally recognized measure, and this allows us to focus our policies on proved methods. I'm sorry, but the audio that we're getting is not very good. Along the years, we have been working with the Empowered Technical Package, and the country has tried to move forward in this sense, despite the fact that it is not a part of like the case of electronic cigarettes that are aimed at young people in our country. Young people between 5 and 13 years of age consume these kinds of products, despite the fact that in our country we have regulations that prohibit the entrance of these products to the country, as well as the trade. So we have to strengthen the inspection and control actions in this sense, especially for these new products, these e-cigarettes or electronic cigarettes, electronic devices. For us, it is necessary to implement, to strengthen the legal framework in our country to be able to improve tobacco control, but
las legislaciones que tenemos están dispersas, es decir, estamos trabajando en función de un marco legal.
Sorry, the audio we're getting is not very good. And we're trying to work in a single legal framework that will be able to work on the different aspects and contribute with tobacco-free Latin America. We have also included municipalities. I believe she said that, where we also have civil society. So that this can foster this movement. For us, this strategy is a path to follow
Muchas gracias. Y una segunda
Thank you
pregunta.
very much, Yolanda.
¿Qué
Second question.
papel está desempeñando el Ministerio de Salud
What
en el avance de
is
medidas
the
frontales
Ministry of
alineadas
Health
con la
role
estrategia regional?
in line with the regional strategy? In the case of the Ministry of Health of our country, this institution is the main engine, and it is aligned with our national measures and the regional vision. And we have several lines of action. We have the strengthening of technical capacities for health professionals with different trainings for health professionals to help smokers stop smoking, and also trainings for sectors, organizations, and civil society according to promote smoke-free environments and to achieve our targets. Each sector has a regulation to prevent smoking from happening. I'm sorry, but the audio we're getting is still very good. And there is also the right of people of choosing smoke-free environments. And we also focus on strategies to abandon tobacco consumption, our health systems,
facilitate, help people that want to stop smoking. And this reflects the commitment that our ministry has in terms of offering comprehensive quality services and that are also efficient. This focuses on primary health care, where we have family doctors and
dispensarizado, es decir, clasificado con todos los factores de riesgo y enfermedades que padecen, y en su asistencia periódica, pues se le hace consejo médico.
And there is medical advice for the to help them abandon this practice and also to reduce exposure to tobacco smoke. And at this level of care, we also have medical visits to places where there is sanitary education or health education. Patients receive follow-up when they try to stop smoking. And they're also smoking interruption follow-up. And if the patient has a very high addiction level, they can also go to mental health specialists. And so this is how we have implemented it in our health system. So we try to do awareness raising as well as abandonment support. And the Ministry of Health also works in surveillance and in prevention at all levels. And consumption is important in our country, and regulations are also important to have a more sustained progress and a more accelerated progress. But Cuba does not use the agreement. Cuba uses and gives a lot of importance to this strategy that guides us, and we use the experiences at a global level and at a regional level.
It is true that this presents some challenges. For example, the law states that in all closed spaces and public spaces, the tobacco consumption is prohibited. But we also have to strengthen this measure. We have the challenge, for example, for the control of products that are prohibited in our country, and we have to do. But we have to improve the control of these products that are not cigarettes, and we have to we have to control the tobacco industry in order to be able to stop this or to reduce its consumption. And well, I want to stress the will of our country to comply with this commitment that was adopted by all the PAHO countries, and that are also aligned with the policies of our country, such as the policies that have to do with the protection of children and youth, and the rights of women and children. And there are different ministries assigned to these different tasks, and in order to implement both the policies of our country and the international policies we have subscribed to. Thank you very much.
Muchas gracias, Elba. Es realmente
Thank you,
bonito
Elba.
escuchar
It's
cómo la iglesia
very
como referencia para algunos
it's
Estados miembros
very
del
encouraging to
G7,
hear about your
países que no son
strategies that can
Estados
serve as an
miembros del
example
G7 y cómo esta estrategia
to countries that are
extendiendo
not
su
part
rol
of the
regional comercial
SMP,
está sirviendo para potenciar los
SMSP,
esfuerzos
and
EPA
this
y
is,
para aumentar la
well, we
eficiencia
can
de
see that
trabajo en
these
distintas áreas de la
measures
sociedad
and
basadas en
these
evidencia de lo
documents
que
are
hemos escuchado en
helping
esta mañana.
to strengthen the
Con
measures in
esto,
Cuba.
me gustaría
With this, I
invitar a
would
nuestro
like to
siguiente
invite our
panelista.
next
Ahora
panelist.
voy a cambiar al inglés para los
I will
intérpretes.
change to English.
Dr. Karen Lewis Bell, Bajo WHO representative in our office in Belize. Welcome to our panel. Thank you for joining us this morning. I'm gonna ask a first question. What barriers do you see at the country level in addressing tobacco control and NCDs in general? And how do you think regional mandates, such as this strategy, can support these efforts, particularly in the Belizean context?
Thank you so much, Diana, and other colleagues. Thanks for inviting me. When I was thinking about this, I could think of three main barriers that countries could face. One of them is having insufficient political will at the highest level, because often the process of tobacco control is led by the technical team from the Ministry of Health. But thankfully for Belize, this is not the case. There is strong political will from the highest level, the Prime Minister, the Minister of Health, and essentially the entire cabinet has supported this process. I think another barrier is lack of awareness. Many policymakers, key stakeholders, and the general population are not fully aware of the harmful effects of tobacco use and its impact on NCDs, as well as other risk factors for NCDs. Many of us have actually been impacted by this, whether it's through cancers, COPD, heart attacks, strokes, or other complications, either in ourselves or family members. But we have not really made the association or the link to tobacco use, either directly or through second or third-hand smoke. Tobacco and NCDs control require an all-of-government approach and a health in all policies approach. This is not just the responsibility of the health sector. We have to build awareness and knowledge in all key stakeholders to ensure strong advocacy and promotion of good health practices throughout all sectors. The third barrier that I could think of was the influence and the financial support offered by tobacco interests, including distributors. In countries large and small, they are often politically connected, have a strong network of supporters, engaged in multiple commercial activities, and deferred to favorably because of their offer of huge financial support for events of all types. Policymakers therefore need to become aware of the relevant articles of the FCTC, including Articles 5.3, 11, and 13, as well as the tactics often used by the industry to market their products and keep people addicted. I do believe that the regional mandates, such as this new strategy and plan of action to strengthen tobacco control in the region of the Americas 2025 to 2030, are excellent guides for countries. The plan of action outlines the 5 key actions to be taken and the indicators to monitor successful implementation. It aligns well with the FCTC. In Belize, the country is making very good effort to implement this plan of action. The FCTC was ratified in 2005, and the draft tobacco bill is now before the Houses of Parliament for debate and approval, hopefully by the end of the year. In fact, it was presented for the first reading in Parliament last week, Friday, and Monday coming, the House Committee will have the hearings from all stakeholders. The tobacco bill in Belize is very comprehensive, and it covers 4 of the strategic lines of action and also addresses electronic cigarettes, heated tobacco products, and a committee to monitor implementation, compliance, and the tobacco industry. Strategic line number 2 will be dealt with through a different process. Efforts have been made by the Ministry of Health and Wellness with the support from PAHO to sensitize key stakeholders, including in the House, the opposition, academia, and more importantly, the media. We really want to try and build allies. A comprehensive public health awareness campaign will commence soon as well. And the focus is on protecting everyone, not just non-smokers. In this regard, a tobacco cessation program is also to be implemented next week, with primary healthcare workers being trained to provide support, including with non-pharmaceutical and pharmaceutical measures. So I think these guidelines are very useful for countries, and Belize is really advancing the process. Thank you.
Thank you, Karen, for sharing the experience of Belize. And from your experience, if you could briefly, you already mentioned some of the actions that have been taken already in Belize, but if you could share briefly with us, how do you see that PAHO contributes, and what's the role of PAHO contributing to national authorities to move forward the tobacco control agenda?
I think PAHO, as the oldest specialized health agency in the world and a renowned technical cooperation agency, is very respected and well positioned to continue providing technical guidance and support to countries to advance tobacco control in the region. The regional level should continue to develop these mandates and provide structured support for awareness campaigns and tobacco cessation programs, and continue to generate the evidence and investment cases to support country arguments for their legislation and other policies. The strategy and plan of action to strengthen tobacco control is an excellent example of such guidance to countries. Resource mobilization to ensure adequate funding to sustain efforts is also important. At the country level, I think that the PAHO office must arm itself with the knowledge of the FCTC and the protocol, and be prepared to provide all the necessary technical support and guidance to the Ministry of Health to assist with moving their tobacco control policies and agenda forward. Legal support and guidance are critical to the process, as well as the sharing of experiences from other countries. We have to ensure a well-timed and comprehensive approach, making sure that all relevant stakeholders are sensitized and awareness built through educational campaigns. We also need to identify local allies and advocates and prepare them adequately with the information and skills needed to counter the tobacco industry's tactics. We also need to ensure that cessation programs are implemented at the community level and done in a timely manner along with the educational campaign. As the PAHO country representative, I must confess that in my previous assignments, tobacco control was not a priority in the countries where I was. And so I never knew much about the FCTC. And so in Belize, since this was now a priority for the government, I had to read as much as I could and actively participate in meetings and workshops to improve my knowledge. While we rely on the regional advisors, at country level, we must also be very knowledgeable on the topic of tobacco control to be able to provide that guidance and support to the country as they advance their tobacco control agenda. Thank you.
Thank you, Karen, and so much for that input. And I'm going to switch to Spanish. Voy a presentar al próximo panelista, que es
I will introduce the next panelist, Laura Salgado, de Corporate Accountability, es decir, rendición de cuentas corporativas, de GGTC, que publica el índice regional de la influencia de la industria tabacalera. ¿Puedes, por favor, compartir tus ideas al respecto?
Por la oportunidad de hablar sobre el índice.
Thank you very much, Lorenzo. First of all, I would like to thank the collaborators of all the countries about that promoted the index and showed the index in their countries, this regional index that is also part or that will also be published this year. Why do we take care of this index? Why do we publish it? It's because the influence of the tobacco industry is mentioned as one of the main barriers for control of tobacco. But the countries have a very important tool. It's the directives, guidelines, 5.3 for the implementation of this article. The guidelines were published in 2008. That is 17 years ago, and we have used this tool for 17 years. And the Framework Convention talks about the importance of the participation of civil society in a framework agreement. We do this monitoring to assess how the governments that are implementing the guidelines of 5.3 are implementing it. How are they protecting their health sector from the influence of the tobacco industry? And this is not only the role of the health ministry, but of the whole government. And this index is based on evidence, and it is calculated based on 7 indicators and the sub-recommendations of the guidelines, and they evaluate if the governments help to evaluate if the governments are following the guidelines and controlling the tobacco industry, and if they are really taking up their social responsibility duties, and if they are able to block the industry, and if there is transparency in these interventions, and if there is something that protects them from a conflict of interest, and if there are measures that are implementing to protect these policies. So the index serves as a tool to measure or assess how the governments are making progress in the implementation of these strategies. And in what way can the governments be helped in these efforts against the tobacco industry? The last one, the last document was in 2023. The next one, the next report will be from 2025, in 2025. This is an important question because the index helps us to identify which are the vulnerable sectors. The Ministry of Health can use this evidence to identify which are the sectors where there is more interference of the industry because they ignore the interference of the industry, or they are not applying the laws of the country. This is one of the useful tools of the index, and it serves as evidence of how the interference of the industry is taking place. To name an example, the guidelines tell us about about the strengthening of the social responsibility of the tobacco industry. So the index asks clearly if the country has regulated or prohibited the promotion of the consumption of tobacco products, or if the industry is still intervening. The index of 2025 shows an increase of the interference of the industry in 9 countries that were assessed in America and the Caribbean. It shows that the industry has included in its policies the pressure to adopt electronic cigarettes or the products including nicotine that have different flavors. And so the industry is trying to stop the processes for increasing taxes or giving lobbying for preference measures for the industry, measures favoring the industry. And there was even an increase in the interference in the environment with campaigns for cleaning the environment, which is not really directed at the toxic pollution that is provided by tobacco products. So there is an interference of the industry, and it shows us also the political will, the importance of political will. Countries such as Peru, Panama, Chile, Uruguay, and Mexico showed strong measures for improving their results. And this index also provides recommendations about what governments can do for the transparency or about preferential treatment of the industry, and thereby protecting the actions of government officials if there is an interaction with the industry. So the political will and the commitment of governments to make progress in controlling tobacco are key words. And as was mentioned at the beginning, the strategic line number 5 of this action plan mentions the protection of tobacco, the protection against the tobacco industry. And so we have to study the vulnerabilities of our countries and take up measures in order to protect our countries. Could you please put a link on the chat where the participants can have access to this index?
I'm going to switch to English, and I want to introduce the next panelist, Barbara McGraw, who's the Tobacco Control Advisor for the Healthy Caribbean Coalition in Jamaica and the Jamaica Coalition for Tobacco Control. Barbara, looking at the current landscape in the Caribbean countries in the Caribbean region, countries still have significant room for progress compared to others in the region regarding regulatory measures in tobacco control. Recently, civil society groups have identified links with the tobacco industry in some Caribbean countries, accompanied by aggressive campaigns promoting nicotine products. In this context, what are the main challenges in the Caribbean for regulating both conventional and emerging products?
Good morning. Thank you. Can you hear me?
Loud and clear.
Okay, great. Thank you very much for inviting me for us to look at the challenges in tobacco control in the Caribbean. You will see some similarities because, of course, as all regions, we do have various challenges. So one of them, which came up earlier, weak enforcement and lack of political will, because we know the governments struggle to enforce laws, and then the problems of monitoring, and they may not prioritize tobacco control. The second area, of course, is of concern to all of us, is that the youth update and appeal of novel products, because the cigarettes, the vapes, the nicotine pouches are increasing in use. The PAHO study recently showed that in Latin America and the Caribbean, about 5.4% are using these new products. And we have, in some of the Caribbean countries, actually more than the actual conventional rate. So that is a challenge. Then we look at the risk of renormalization, where our youth will actually be using both cigarettes, and of course it undermines our past gains in tobacco control. One of the challenges I see is the ambiguity, regulatory ambiguity on product categorization, and of course gaps in supply side, because is it a cigarette? Is it a tobacco product? Is it a nicotine delivery device? Such categorization matters for how it is regulated, how it is taxed, any importing, labeling, and advertising. So I do see that as one of our challenges. Taxation and price measures, we discussed that we have benefited from taxes and increase, but because of the novel products, they don't quite fit into the box. How are we going to monitor? How are we going to look at taxation? Of course, the big elephant in the room, the tobacco industry influence, their industry, their interference, and they're increasingly targeting emerging products, often marketed them as less harmful. Of course, that is going to complicate the whole regulatory story. Next, the public education and awareness. There's still a lack of public awareness regarding the health dangers of both conventional and the new emerging products. So the field, especially with youth, we are seeing that they say they think it's safe and think it's cool. Of course, that's buttressed by the industry narrative, as we all know, harm reduction or safer alternatives. So there's a gap in consumer knowledge. We need to look into that. Resource constraints and competing health priorities. I think everybody is aware of that. The small island developing states with limited public health resources, heavy burdens on non-communicable diseases and other pressing health and financial demands. So tobacco control, especially the novel product, doesn't always get the sufficient prioritization. Economic dependencies, we see where some nations rely on the tobacco-related industry for employment, and some of them may be useful with the tax revenue. So that can create resistance to tougher tobacco control regulations. Limited regional coordination. While there are regional bodies, of course, CARPHA, PAHO, CARICOM, which advocate for tobacco control, I feel there's not enough action at regional-wide strategies. Some of the countries may have their own approach, and this fragmented regulatory environment may allow the tobacco industry to exploit regulatory loopholes, which I'm sure they're doing. And finally, the challenges is varying levels of civil society support. We know how important civil society has been to making inroads and supporting tobacco implementation and fighting the tobacco industry. Also technical support. So this is partially due to resource mobilization, lack of funding, but also technical persons that are available and willing to work in the area in the Caribbean. Thank you.
Thank you for that, Barbara, and for sharing those examples and those needs in the region. I'm conscious of time, so we wanted to have time for more questions, but unfortunately we don't have the time. So I think we will need to close. And I will speak switch to Spanish. Quiero agradecer profundamente a todos los panelistas y sus
I would like to thank all panelists for their valuable comments and contributions. This shows how important government and civil society are for the control of tobacco products in the America. We invite you all to continue cooperating towards these goals of 2030. And I will give back the mic to Diana, who will talk, who will tell us, or will close this session. Yes. Diana? Well, thank you very much for to my colleagues and the panelists that were present this morning. It has been a very interesting discussion that has enriched the presentation by Luciana this morning. I would just like to make some specific comments about the questions in the panel and the comments. As PAHO, we and WHO recommend and to enhance regulations against all products, not only the conventional ones, but the new ones of tobacco and nicotine, in line, of course, with the guidelines established in our documents and the COP. And we also want to tell you that PAHO has already issued a communication that there is no safe level of tobacco consumption or nicotine consumption. So all of the levels imply a risk for health. And this also includes the risk of addiction to nicotine in general. And I would also like to say that this does not only imply the risk or impact on health. We have to mention that the level of risk that a product can have is to misinform the population or not inform the population. For example, if we use these categories such as electronic devices, electronic cigarettes, these products are come in a great variety, and it's very difficult to control all of them in our legislative measures, with our legislative measures. It's very difficult to control the level of safety of these products. So this is why we have said that there is no safe level of consumption. And WHO has also stated its concern about the fast increase of emerging products, especially electronic cigarettes among children and adolescents. And in this sense, considering not only conventional products, but also emerging products with a similar treatment, this will lead us to progress in controlling the dangers of tobacco. There are different levels of safety, of course, in these products, but we have to point out that WHO has already stated that in a communiques that there is no safe level of consumption of these products. And in this sense, I would like to stress what many panelists have already mentioned, that it is very important to strengthen our policies for controlling tobacco based on strong evidence and free of conflicts of interest. And with this, we can strengthen the efforts of different actors, such as the government and civil society and academia. Thank you very much for this very enriching discussion, and I would like to give the floor to Rosa Sandoval, who was the moderator of this webinar, so that she can close it. And thank you for staying this additional time with us. Thank you, Diana and Laurent, for facilitating this excellent panel. I would like to give the floor to Daniel for your closing statement. Thank you, Rosa, to all panelists and to all the public present and the moderators. And well, I will close this event in the name of the Global Alliance for the Control of Tobacco. And I want to speak about 4 brief messages. This dialogue shows that control of tobacco in the Americas is not based only on the actions of one actor, but on a common commitment. And the law, the report is not only an effective tool for informing the government and the civil society that it is important to work towards sustainable policies and control commercial interests. And the regional strategy also is here in a very strategic times. It helps us in the Americas, and it reminds us that the facades used by tobacco product fabricants show us that there is a high index of interference, and we have to enhance the enforcement of Article number 5 of the Framework Agreement, together with the documents presented by each country and about their accountability, will help us to establish a tobacco-free region and fighting nicotine. And we are free of interest conflicts as civil society representatives, so we call on all of you to adapt your national plans with the regional plans to the regional plan of PAHO about tobacco products and, of course, the protocols. And in the framework of 20 years of the framework agreement and the conference that will take place in Geneva in November, this is the moment to enhance our commitment and to make public interest, public health interests prevail over the interest of the industry and create tobacco-free societies. And I thank you very much again, and I give you back the floor, Rosa. Thank you very much, Daniel, for these closing arguments. We only have 8 minutes left, are only 8 minutes behind. I want to thank all the participants. We have had many questions, both in the Q&A and in the chat. And I just wanted to say goodbye to you until the next webinar with 2 final messages. The first is to thank you all for your questions and your interest in emerging nicotine and tobacco products. There is a great concern, as Diana said, on our behalf, and I see that it is also present among you, that these products help to normalize again the consumption of tobacco products, and thereby causing a backlash in our region. And the second one is about the strategy for controlling the use of these products. We are sharing in the chat the messages of the countries, and we know that we have to establish strong regulations. And here I would like to say that it is important to pay attention to this alarming increase of consumption of electronic cigarettes, that is vaping, and many of you have asked about this. And I want to show you how the measures of control should be extended to these products. And in the countries where we don't have totally tobacco-free environment laws, this is a measure, one of the goals in the region, but we haven't arrived at reaching the goals of a tobacco and a smoke-free environment. And I wanted to say that it is very gratifying to see that there are progress made in countries such as Cuba and Belize, and that other countries in the region are adopting these measures. And as I mentioned, tobacco-free environment, I also want to mention pending tasks. For example, the creation of a prohibition, complete prohibition of nicotine and tobacco products. And this is one way, one channel through which we transmit or we hear publicity that is not based on truth. So I would like to thank you for the active participation of all of you, and goodbye to everybody. Thank you very much.